This presentation explores the connection between drugs and crime in the United States. We'll examine the historical context, criminological models explaining drug-related crime, disparities in enforcement, and the evolving policy landscape. By the end, you should be able to assess both traditional and progressive approaches to addressing drug use and associated criminal activity. The war on drugs was launched in the 1970s under President Nixon, who declared drug abuse public enemy number one. It intensified in the 1980s under President Reagan, resulting in mandatory minimum sentences and a significant increase in incarceration. These policies disproportionately affected minority and low-income communities with long-term consequences for families and public trust in law enforcement. Drug-related crimes can be classified into several categories. Number 1, possession or use of controlled substances. Number 2, trafficking or distribution. Number 3, manufacturing or cultivation of illegal drugs. And number 4, crimes committed to support addiction, such as theft or prostitution. Understanding these distinctions is essential for identifying appropriate criminal justice and public health responses. The psychopharmacological model suggests that the pharmacological effects of drugs can contribute to criminal behavior. For example, alcohol and stimulants like cocaine can lower inhibitions and increase impulsivity or aggression. This model helps explain violent crimes committed while under the influence, but does not fully account for systematic patterns or context. The economic compulsive model argues that addiction leads individuals to engage in crime to support their drug habit. Common crimes include burglary, robbery, and sex work. This model explains nonviolent, opportunistic crimes, particularly in impoverished areas where access to treatment and social support is limited. The systemic model focuses on the social context of illegal drug markets. It examines how violence and corruption are embedded in the distribution and sale of drugs. Examples include gang turf wars, drug cartel violence, and conflicts between dealers. This model is particularly relevant to organized crime and urban violence related to drug control. The most commonly abused substances in the United States include opioids, both prescription and illegal, methamphetamine, cocaine, cannabis, and benzodiazepines. Synthetic drugs like fentanyl have dramatically increased overdose risk. Understanding substance-specific patterns helps inform treatment, prevention, and enforcement strategies. The opioid crisis has reshaped the landscape of drug use and crime, beginning with the overprescription of painkillers like OxyContin in the 1990s. The crisis has evolved into a fentanyl-driven public health emergency. Over 100,000 Americans died of overdoses in 2022 alone. The crisis intersects with homelessness, mental health, and rural health care gaps. Urban areas often see high levels of drug enforcement and incarceration, particularly in marginalized communities. Rural areas, while less policed, often lack adequate treatment infrastructure. The result is uneven access to care and justice with differing policy outcomes based on geography. Drug crimes impact communities through increased violence, family disruption, and economic stagnation. Public resources are strained by enforcement and healthcare costs. Over-policing can erode community trust, while untreated addiction perpetuates cycles of poverty and criminal behavior. Black and Latino individuals are significantly more likely to be arrested and incarcerated for drug offenses than white individuals despite similar usage rates. This disparity is rooted in both systemic racism and targeted enforcement strategies in urban communities. More than 400,000 people are incarcerated in the United States for drug-related offenses. Mandatory minimums and three-strike laws contribute to over-incarceration. Critics argue these policies prioritize punishment over rehabilitation and disproportionately affect low-level, nonviolent offenders. Public health approaches to drug crime emphasize harm reduction and treatment over criminalization. Examples include supervised consumption sites, medication-assisted treatment, and Narcan distribution. These strategies aim to reduce mortality and improve long-term recovery outcomes. Recent reforms include marijuana legalization, sentence reduction for nonviolent drug crimes, and diversion programs that offer treatment instead of jail time. Drug courts have proven effective in reducing recidivism and supporting rehabilitation. Still, implementation varies widely by state and jurisdiction. In conclusion, drug-related crime is not driven by a single factor, but by a combination of forces. Addressing this issue requires comprehensive strategies that blend law enforcement, public health, and social support. The future of drug policy lies in data-driven, equitable solutions that prioritize human dignity and long-term community well-being.